Namaste. Today I am going to talk about the lateral wall of the nasal cavity. In the previous video, I have uploaded about the medial wall, roof and the floor of the nasal cavity. Hope you're going to like it and subscribe my channel. The skeleton framework of the lateral wall of the nasal cavity. This portion is known as the lateral wall of the nasal cavity. It is formed by the bony part. Within this bony part, the most anteriorly there is a presence of this small bone. This is known as the nasal bone. Then after beneath that, there is a presence of this bone. This is known as the frontal process of the maxilla. Then when you go more posteriorly, there is a present small bone. This is known as the lacrimal bone. Then after that, there is a presence of this swelling which is present. This is known as the konka. This is known as the superior concha and this is known as the medial concha. This superior and the medial concha is formed by the labyrinth of the ethmoid bone. Then there is a presence of one more swelling that is present. This is known as the inferior concha. This inferior concha is formed by the bone itself, name which is known as the inferior concha. Then when you move downwards, there is a presence of the one more bone that is present. This is known as the perpendicular plate of the palatine bone. Then when you go posteriorly to the perpendicular of the palatine bone, there is a presence of this bone. This is known as a medial pterygoid blade of the sphenoid bone. Along with that, there is a small bone that is present between the medial concha and the inferior concha. This bone is known as the uncinnated process of the ethmoid bone. And these are the skeleton of the lateral wall of the nasal cavity. This skeleton part of the nasal cavity is covered by the mucous membrane, and this is how it will look in the human body. Now the superior concha. This portion is known as the superior concha and it is formed by the bone which is known as the ethmoidal labyrinth. In between the superior concha and the medial concha, there is a presence of space. This is known as the meatus. This meatus is known as the superior meatus. This concha compared to the medial and the inferior concha, it is the shortest and the swallow. Now between this concha, there is a present space which is known as the superior meatus. Within the superior meatus, there is the opening of the sinus that is present. This opening of the sinus is known as the posterior ethmoidal sinus. Now this is the superior concha. Above the superior concha, there is the presence of the one more space which is known as the supreme meatus. Posterior to the supreme meatus, there is the presence of the recess. This recess is known as the spinoethmoidal recess. Now this portion is known as the spinoethmoidal recess. Within this, there is a presence of the opening of this sinus which is present. This is known as the opening of the sphenoidal sinus. Now the medial concha that is present. This is known as the medial concha. The medial concha is also formed by the ethmoidal labyrinth. It extends backwards and get articulated with this bone. This is known as the perpendicular plate of the palatine bone. Now in between the medial and the inferior concha, there is a presence of the space. This is known as the medial meatus. Within this medial meatus, there is a presence of the swelling that is present. This is known as the ethmoidal bulla. This ethmoidal bulla is formed by the bony elevations. Within this, there is a presence of the sinus opening. This small sinus that get opens, this is known as a medial ethmoidal air sinus. Now, this is known as the ethmoidal bulla. Beneath the ethmoidal bulla, there is a presence of this portion. This is known as the hiatus semilunaris. This hiatus semilunaris is crescent shape, and within this there is the presence of this sinus, the large sinus that get opens. This is known as the opening of the maxillary sinus. Now this opening of the maxillary sinus get reduced in size by the help of the two bones. That is the descending process of the lacrimal bone in the front, uncinnated process of the ethmoidal bone above, the inferior concha below, and the perpendicular plate of the palatine bones. Along with that, there is a presence of the one more structure that is present, which is known as the ethmoidal infundibulum. This portion, this is known as the hiatus semilunaris. This hiatus semilunaris, the inner part which continues upwards, this portion is known as the ethmoidal infundibulum. Within this ethmoidal infundibulum, there is the opening of this sinus which is present. This is known as a frontal sinus. With the help of this duct, this is known as a frontonasal duct, which gets opened into this area, which is known as the ethmoidal infundibulum. Anteriorly, there is a present one more sinus that is present. This is known as the anterior ethmoidal sinus, which opens into the ethmoidal infundibulum. Now, when you go more posteriorly to the palatine bone of the bone, there is the presence of this opening that is present. This is known as spinopalatin foramen. This spinopalatin foramen, the landmark for this that it get approaches along with this meatus. This is known as a medial meatus. The posterior ends of the medial meatus, there is a presence of the opening. This is known as spinopalatin foramen. Now from this spinopalatin foramen, there is a part of the last artery. This artery is known as a spinopalatin artery. Now next part is known as the inferior concha. This portion is known as the inferior concha. It is thin and it is a separate bone. It is present within the nasal surface of the maxilla. This is the nasal surface of the maxilla. Along with this area, this is the palatine bone, which is the perpendicular plate of the palatine bone. The lower border of this area is gently curved, and the spaces between this maxilla and this portion which is known as the inferior concha, there is a presence of this space which is known as the inferior meatus. And this portion is known as the largest meatus. Now the ends, this portion, the inferior meatus, get ends about 1.25 centimeter in front from this area. There's the opening of this area which is known as the opening of the auditory tube. It is also known as the opening of the escutcheon tube. Now within this inferior meatus, there is a presence of the opening of this area which is known as the nasolacrimal duct. Now the artery supply. It is divided into the four quadrants. The anterior superior part is supplied by this artery which is known as the internal nasal branch, which is a branch of the anterior ethmoidal artery. Then after that, the posterior superior part is supplied by this artery which is known as the lateral branch of the posterior ethmoidal artery. This portion is known as the anterior inferior part, which is supplied by the branches of this area, which is the branch of the nasal branch, which is the branch of the ethmoidal artery. And there is also a branch of this artery which is known as spinopalatin artery. Posterior superior part, posterior inferior part, it is supplied by the spinopalatin artery, and also it is supplied by the lymphatic artery. Now the venous drainage. It is drained through the area. This portion is known as the anterior ethmoidal vein, and this portion is known as the posterior ethmoidal vein, which drain directly through the cavernous sinus. Now this vein is known as the spinopalatin vein, which directly drain into the pterygoid plexus, which is present in the infratemporal fossa. Now the lymphatic drainage. The anterior part of the nasal cavity will drain into this lymph nodes, which is known as the submandibular lymph nodes. The posterior part of the nasal cavity will drain into this lymph nodes, which is known as the retropharyngeal lymph nodes. Now the nerve supply. It is supplied by the sense of the smell, which this nerve is known as the olfactory nerve, and this, the anterior superior part, is supplied by this nerve, which is known as the anterior ethmoidal nerve. The anterior inferior part is supplied by this nerve, which is known as the anterior superior alveolar nerve. Now the posterior superior part, it is supplied by this ganglion, which is known as the pterygoid blade ganglion. From this, it gives rise to the branch, which is known as a posterior lateral nasal branch. Now this portion is known as the anteposterior inferior part, which is supplied by the branches, that is the anterior palatin branch of the pterygoid blade ganglion, and also there is a presence of the secretory part, which is formed by the pterygoid blade ganglion, this ganglion which is known as the pterygoid blade ganglion, and also the vasomotor, it is supplied by the superior cervical ganglion. This finishes the lateral wall of nasal cavity. Hope you're going to like it and subscribe my channel. Now my next video will be the clinical correlations of the nasal cavity.